Bismillahirrahmanirrahim. So today we are going to see about very important topic, atelectasis. Okay. So atelectasis, ectasis means dilation. So we are going to talk about related to the alveoli. So normally alveoli is in dilated form. Even after expiration, that's what we discussed in the basics part 2. So even after expiration, the alveoli is in the dilated form because of some presence of residual air. Because of the residual air. Okay, let me tell one analogy so that you can understand. So we have a balloon, right? This is a balloon, and this balloon is not. This is a balloon. Now a person is blowing air into the balloon. Is blowing air into the balloon, and what happens? The balloon gets inflated. That is, the balloon is getting air inside. Okay, so now the air went inside, and the person is not closing the mouth of the balloon, and what happens, immediately all the air goes out and the balloon becomes like this. So when all the air goes out, okay, the balloon becomes collapsed. So this is called collapsed. Okay, so all the air goes out. Okay, now you consider alveoli. See, if you see alveoli is never been like this, like a collapsed state. Why? Because now this is the state of the alveoli. If the now the person is taking air inside, now the air goes inside. What happens? The alveoli gets bigger. Alveoli gets bigger, and because the air went inside, now the air is going outside, so then the alveoli becomes smaller. It is not getting collapsed like this. It is not getting collapsed like this, like a balloon. Why? Because the presence of some air after expiration. After expiration. So this is the characteristic feature of the alveoli. In that way it differs from the balloon. Okay, so this is the characteristic feature of the alveoli. Okay, now why I told this before starting atelectasis, because we are atelectasis means collapse. Atelectasis means collapse of the lung. Atelectasis means collapse of the lung. So normally if you see the lung, these are the bronchioles, and you will be seeing alveoli. We need good alveoli so that the gas exchange can happen. So if the alveoli are becoming like this, if the alveoli are becoming like collapsed, what will happen? So due to some reason the alveoli, instead of like this, it is becoming like this. It is becoming like this. It is called collapsed alveoli. What happens if there is collapse of alveoli? The amount of air enters the lung is reduced. So that causes loss of lung volume. Lung volume, that is air entering the lung is reduced. Then it, why it is happening? Because air space, that is alveoli, is cannot expand. Alveoli cannot expand. So this is lost. So because of this there is loss of lung volume. Okay, if there is loss of lung volume, what will happen to the gas exchange? Now you have a capillary, right? And the deoxygenate or carbon dioxide should go out, then they have to take the oxygen. So what happens? Because of less volume they cannot do this process, and the capillary go with carbon dioxide. They will not take oxygen, they will go with carbon dioxide. So they go for ventilation perfusion imbalance. They go for ventilation perfusion imbalance. They go for ventilation perfusion imbalance. Okay, so this will leads to severe hypoxia. Okay, why? Because if there is no oxygen in the blood, then that is called arterial hypoxemia. So I told in the basics part 2, we measured by putting the clip in the finger, that is called pulse oximeter. Normally the pulse oximeter shows partial pressure of oxygen around 95. So if the person is having ventilation imperfusion imbalance, this will be reduced. This will be reduced. Understand? See here, only the collapse of alveoli happens. The gas exchange area, that is alveolar capillary membrane, interstitium, and the alveolar epithelium is not damaged. So alveolar epithelium and the interstitium and the alveolar capillary endothelium is not damaged. So only it got collapsed. So because of that collapse, the oxygen is not going. So if you give oxygen in this patient, they will have improvement. They will have improvement. Understand? Because the gas exchange area is not damaged. The gas exchange area is not damaged. Only you have to do is you have to remove the cause which made the alveoli to go for collapse. You have to remove the cause. Understand? So you have to discuss what causes this kind of collapse. Okay, so now let us take an example. This is the trachea and this is the bronchi and this is the lung. So you all know this gives 3 branches for 3 lobes. Now there is some block here. There is some block here. Understand? So it may be a increase. You all know they have glands, right? Bronchus has glands. It may be increased secretion of the bronchial glands, mucus. They can block, or the child can take a coin, foreign body that can go and block. So anything it gets blocked, what happens? The alveoli is not getting new air. Okay, what happens? The residual air is remaining. After a few period of time, the residual air is taken by the capillaries. It is taken by the capillaries. Then the alveoli is not having residual air and new air is not coming. So automatically the alveoli becomes collapsed. Alveoli becomes collapsed. So this is due to obstruction. This is due to obstruction. There are some diseases which produce increased mucus, especially in the smokers, called chronic bronchitis, bronchiectasis, and asthma. All can produce increased mucus secretion, or the persons may have some disorder, cystic fibrosis. So that is a condition which have very thick mucus. So that will come and block. So these are the hereditary conditions. The cystic fibrosis hereditary conditions. Now what you have to understand here is, whatever it may be, if there is obstruction or foreign body is coming and obstructing, the residual air is slowly get absorbed. So that leads to the collapse of the lung because new air is also not coming. So this kind of atelectasis is called resorption atelectasis. Resorption atelectasis, because the residual air is absorbed. Resorption atelectasis. Okay, now let's see in other scenarios. This is the lung. Okay, what you are going to see here is, and you all know lung is covered by pleura. Okay, I'll draw different color for the pleura. Lung is covered by the pleura, and you all know the pleura has two membrane. One is very closely attached to the lung itself, and in between they have fluid. In between they have fluid. Okay, and you all know we have a rib cage, right? Ribs comes like this. Okay, so here we have heart. Okay, so if the person is right heart failure, so the from the venous side the blood cannot enter. This is the venous side, the blood cannot enter, so then automatically more fluid gets collected in the pleura. When more fluid gets collected in the pleura, what happens? The pleura expands. When the pleura expands, and the pleura expands because of more fluid getting collected, then automatically the lung is compressed. The lung is compressed. So because of what? Because of fluid in the pleura. More fluid coming because of right heart failure. More fluid getting coming because of right heart failure, and the pleura is compressing the lung. So pleura is compressing the lung. The pleura is compressing the lung. So why? Because of the congestive heart failure. Okay, so this is mechanical collapse of the lung. Okay, another condition is, I told there are rib cages, right? So if the person got accident, the rib cages has fractured, then immediately air from outside can enter the pleura, and that can compress the lung. So that is a condition called pneumothorax. Pneumothorax. So this is kind of atelectasis. We call it as compression atelectasis. Okay, now let's see another type of compression atelectasis. Okay, now the person is lying down. Okay, this is the diaphragm. This is the diaphragm. And what happens when the person is taking bed rest for longer time due to any reason? Okay, this diaphragm always will be going into the thorax. This diaphragm will be always going into the thorax. That will compress the basal part of the lung. That is compressing the basal part of the lung. So this is called basal atelectasis. It is a kind of compression atelectasis. Okay, now let us discuss about another type of atelectasis. Okay, and you all know this very easy one, and this is trachea, and this is the bronchi, and this gives a branch. So they go to the lung, and you all know the lung is covered by the pleura. Okay, lung is covered by the pleura. So sorry, the pleura is becoming a little bit big here. Okay, pleura. Okay, lung is covered by the pleura, and you all know the bronchus gives branches, they form bronchioles, and they form alveoli. Okay, let's draw one alveoli, and the alveoli are covered by the capillaries. Okay, now what happens due to some chronic inflammation inside the interstitium? There is fibrosis. Okay, you all know the fibrosis causes contraction. When the fibrosis is contracting, what happens? This alveoli is when the fibrosis is contracting, this alveoli will be compressed because of contraction of fibrosis. Because of contraction of fibrosis. Understand? So this is called, or the even the fibrosis can happen. The chronic inflammation can happen in the pleura. In the pleura, that is can cause contraction, and that can compress the lung. That can compress this fibrosis can compress the lung itself. It can compress the lung itself. They can compress the lung itself. So this is contraction due to fibrosis. This lung is collapsed, so it is called contraction. This is called contraction atelectasis. It's called contraction atelectasis. Okay, so this is about atelectasis. Understand? So what happens in chronic inflammation? The fibrosis sets in, they go for severe contraction and they will compress the lung, they will contract. Because of the contraction, they mechanically collapse the lung, which is called contraction atelectasis. Okay, so these are the various conditions can produce collapse of the lung. Okay, so let us discuss another condition which is called acute lung injury. This is a clinical emergency. Please try to understand. It's very important. It comes under clinical emergency. If you are going to playful with this patient, the patient will die. Okay, so you have to act immediately. So what is the problem here? The problem is, you all know the alveoli, and you all know this is the capillary, and you all know the capillary has endothelium, and endothelium sits on the basement membrane, and you guys all know this. This is the endothelium. You all know the endothelium sits on the basement membrane. Okay, and this is the flat epithelium, type 1 epithelium, and this is cuboidal type 2 epithelium, and this is type 1 epithelium, this is type 1 epithelium, this is type 1 epithelium, this is cuboidal epithelium, this is type 1 epithelium, this is type 1, and this is also type 1, and they go for ciliated columnar epithelium in the bronchus. Okay, so what you are seeing is, this is interstitium. What you are seeing here is interstitium. If this alveolar epithelium is damaged and endothelium is damaged, this will lead to severe inflammation that will bring lot of exudate, that will lead to severe acute lung injury, because if there is full of fluid, air cannot go inside, and even if air goes, the gas exchange cannot happen because gas exchange area is completely damaged. So this is a serious condition. So what you have to understand here is, this condition is called acute lung injury, and the most causes of acute lung injury are pneumonia. Pneumonia means lung infection. Pneumonia means lung infection, or sepsis. Sepsis means, we mean septicemia, that is infection coming through the blood, or the person is having trauma. Okay, it could be burns or any trauma that creates shock. The shock creates vascular damage, and if there is, the person aspirate the gastric content. If the person aspirate the gastric content, that will, the gastric content has acid, that will completely irritates and destroys the alveolar epithelium. So these are the things will produce acute lung injury. And remember, clinically they have severe dyspnea, difficulty in breathing, and because of alveolar damage and the endothelial damage, and they cannot able to take the oxygen. So what will the pulse oximeter shows? Reduced oxygen, that is called arterial hypoxemia. And if you see the chest x-ray, if you see the chest x-ray, it will have full of fluid, that we call both the lungs bilateral. Both means bilateral. Pulmonary means lung, pulmonary infiltrate. Infiltrate means fluid, cells and proteins. So we call that all together as infiltrate. So mainly of inflammatory cells, okay, neutrophils. So it is full of neutrophils and cells, and they completely damage the gas exchange area, diffuse damage, and happens both the lung. It is called bilateral pulmonary infiltrate. Remember, this whole thing happens not due to cardiac failure. If due to cardiac failure, you will not see any cells or proteins. You will see very less protein, and you will not see any inflammatory cells. It is full of transudate. So it is not due to cardiogenic edema. Understand? You have to understand this, because in cardiogenic edema, gas exchange area is not damaged. Actually, because of increased hydrostatic pressure, the fluid is entering. Whereas here, the fluid is entering because of the damage in the epithelium, alveolar epithelium and alveolar endothelium. Please remember that. Please don't get confused. It is non-cardiogenic. Otherwise, it is called as non-cardiogenic pulmonary edema. It is very important to understand this, because here the gas exchange area is damaged. So when you give oxygen therapy, that will not increase the partial pressure of oxygen what you see in the pulse oximeter. This will not be useful because the gas exchange area is damaged. Whereas in cardiogenic pulmonary edema, if you give oxygen, that will increase the pulse oximeter oxygen level. Understand? So this is a major difference you have to understand. So this is we call refractory to oxygen therapy. This is we call refractory to oxygen therapy. So you have to understand this. So the clinical syndrome of acute lung injury is called as acute respiratory distress syndrome. It is called as ARDS. Okay, it can seen in the children, it can seen in the adult. In the children, it is mainly due to surfactant deficiency. In the adult, it is due to infection or trauma or aspiration of the gastric content. So what happens is this damage the what are the alveolar epithelium is damaged, and capillary endothelium is damaged. Okay, so because of this, if you give oxygen, oxygen will not go here. Okay, oxygen will not go here. So this is called refractory to oxygen therapy. So this is happening all over the alveoli. So we call diffuse alveolar damage. So because of this damage, what happens? That increases the vascular permeability. All the fluids are coming, and now alveoli is getting the fluid. This is called alveolar flooding. And because of all the fluid is coming and the alveoli is damaged, and oxygen diffusion is reduced, because oxygen diffusion is completely lost. So it is called loss of diffusion capacity, and because type 2 epithelium is damaged, no surfactant is reduced. Okay, so these are the problems happens due to the damage happening in the alveolar capillaries and the alveolar epithelium. Okay, so why it is happening? Let's discuss that. You all know in the alveoli we have macrophage. This macrophage is stimulated, they release IL-1, TNF. You all know about IL-1 and TNF. They are acute inflammatory cytochemical substances, and here they also additionally add IL-8. This will go to the capillaries and they recruit neutrophils. Now a lot of neutrophils comes. If neutrophils comes, it is very dangerous. They release their enzymes, and this chemical substance also activate the endothelium and they damage the endothelium. Okay, and neutrophils also coming, and they also release their enzymes and they damage this epithelium. Now because this damage to the epithelium, now the fluids and the endothelium, the fluids are coming, and the fluids comes with protein, and this protein gets deposited in the this protein deposits in the membrane. It looks like a protein deposition in the alveolar membrane. This is called hyaline membrane. This is called hyaline membrane. So pathologists we sometimes call it as hyaline membrane disease. Okay. So in the end, the lung is filled with fluid. So when the lung is filled with fluid, it becomes weight, heavy, and microscopically you will be seeing this hyaline membrane damage and full of this exudate. So this is the characteristic feature, and it is difficult to save the patient. If the patient survives, they will go for severe fibrosis. They go for this blue color is the fibrosis. They go for severe fibrosis, interstitial fibrosis. Okay, because the damage is permanent, so they will heal by fibrosis. Understand? So the patient lives with contracted lung. Okay, so this whole setup starts due to some infection, but the whole insult happens within 72 hours, and especially the patient of old age and septicemia and multiple organ failure patient, they all will have bad prognosis. Even if the patient survives, they have to survive with interstitial fibrosis. What happens in X-ray? If you see X-ray, the lung area is seen as a black shadow because of air. What happens? This is normal. In the ARDS lung, there is no way to enter the air because it is full of fluid. It is full of fluid. So you will not see the black shadow because air is not going inside. If air goes inside all the area of the lung, it will become black. Now few areas also, sometimes they go in only in few areas which is not affected. Okay, so most of the areas will be full of fluid because it is a bilateral pulmonary damage, and it is full of pulmonary infiltrate, that is the exudate, and it looks white in appearance in X-ray. So sometimes they call it as a white lung. Understand? So this is about ARDS. Okay, this ends the explanation of the lecture number 15.